Well, thank you, Madam Chair, and I also am just grateful for the opportunity to wave on and happy 11th anniversary to the Affordable Care Act. And I was so proud to help craft it as a member of this subcommittee, the Health Subcommittee, and to be a member of the Energy and Commerce Committee to actually get this done. And I've heard many wonderful, life-changing stories that people have experienced because of the ACA, and I want to just acknowledge the words of Laura Hatcher, and thank you so much for your words and sharing your experience, but also for the little lobbyists who we've seen in the Capitol for a long time. And it's just been priceless, that the influence that they have. But still, we can definitely make improvements. In Illinois, we had a problem with network adequacy. That was actually for a while. It's better now, but for a while, many Affordable Care Act plans did not include any of the major hospital or affiliated doctors in the Chicago area. And while the law absolutely says that there must include inclusive adequacy networks and access to specialists, it didn't happen. And so, Professor Keith, I wanted to ask you, can you speak to the importance of network standards to ensure that patients are able to have a good number of choices and have the doctors and the providers that are really needed for them in particularly?
Thank you for that very important question. So you're right, the Affordable Care Act included network adequacy standards. I think many people have started encouraging what we call quantitative network adequacy standards, which really say that a patient should be able to find a primary care physician or a specialist or a hospital within a certain distance from their home or where they work. And this is the idea that folks should have good access to actual providers in their neighborhood or close to them. An example would be being able to find a primary care physician within 10 miles or 15 minutes, and those standards would change based on rural, urban, or suburban areas, things like that. So really a way to include access to actual healthcare providers.
So the key word is quantitative, and let's hope that we can get there. I want to also mention to you that some states actually have the authority to lower premiums if they are felt to be exorbitant. Illinois is not one of those states. We can oversee, but we cannot do anything actually to change that. We can review these numbers. And so I wanted to ask you, is it, can we require, when we improve this act, to make sure that all states are able to look at and review these rates and make adjustments to the rates?
Certainly. So the Affordable Care Act included what we call rate review standards, but you're exactly right. Not every state has what we call prior approval authority, meaning they can actually deny the rate that an insurance company wants to use before it goes forward. I think there's been a lot of focus today on healthcare costs. I think rate review is one way that state regulators and federal regulators could really leverage and put pressure on insurance companies to help bring down healthcare costs. The whole goal here is to make sure that costs are fully justified and that consumers aren't, paying more than they should be paying. I think it's a huge consumer protection.
Absolutely. So I just wanted to say that my bill that's in this packet, HB 1890, the Healthcare Consumer Protection Act, has two things that I was just really talking about: to set network adequacy in the way that you described, to make sure that everyone can have access, and to make it standard, to set network adequacy standards. And I guess my bill says that CMS would do that. And secondly, to permit all states to be able to address the excessive rates by actually requiring a reduction in those rates. I know that there are many times that it would have been very helpful to us in Illinois not to just comment on it, not just to be reviewing it, but to have some actual power. So I am almost out of time, and I want to thank all of the wonderful panelists for being here. And it's been an honor to be able to wave on to your committee, Madam Chair, and I yield back.